And now we're going to have our tasks, right? We have our triggers. Now we're going to have our tasks. So I'm going to jump in here and you can have as many tasks as you want. All right, I'm going to name this task. I'm going to give it a name that says we need to lock our intake assessment. I'm going to put in some instructions. And then I'm going to say, okay, what actually needs to happen? All right. And we talked through the various options of we need to do something with a form, right? We need to create a form or lock a form. Talked about custom actions, which is just make a phone call or do something outside the system that ClinicTracker wouldn't know about. And then smart flows, which is your actions that can happen automatically, like messages that get sent based off a template. Right? Going back to our example, what we're interested in is once we create our demographic record, our new patient, we need to lock. So not just create or not just update, but actually finalize and sign off and lock this sample intake assessment. Okay. Now that we know what triggered it and what needs to happen, we need to decide the two more things we talked about, which is when is it due? Right? In our example, we're going to be due in 7 days, and then 7 days based on what? So always have to give you as many options as possible. In this case, it's going to be 7 days based off the date entered, the specific date that was noted when recording the demographic record. Right? You have other options here. For example, the timestamp of when you created the demographic record, right? So today's January 13th. That would be the timestamp if I created a patient right now. Whereas if I put today that the patient really came in yesterday, but I just hadn't gotten around to recording their information, this would be 7 days from whatever that date I entered is. And you see some other options you have here as well. The last thing we discussed is who's responsible, right? In this case, I have a specific individual. I'm going to press the F2 so we can see the pop-up form and see all the options, all right? So we can have a specific named individual, which is what you see down here. I selected my name off. We can have a group, all right? So our group 1, group 2, you can define these however you want. So this could be your intake team, it could be your billing team, it could be your administrative team, whatever groups that you have that you might want to assign a task to any one of a member of a group, right? Those are your groups. We have staff assignments, right? So rather than assign to Josh, assign whoever is the therapist based on the staff assignments for the patient. Okay. And then we have a couple other options, intake clinician or follow-up clinician from demographics. You can assign it also to the triggering user, the person that takes the action that fires the trigger. All right, so in this case, the person that creates the demographic record. All right, whoever creates a demographic record, they're responsible for taking the next step. Right. So again, always giving you options, but for this example, we decided that I am the only one ever responsible for completing this task. Okay. All right, so we've at this point created our workflow, right? We can make this as in-depth or as simple as we want. We can add additional tasks if we want. So if we not only wanted to send, create a task for locking this intake assessment, we also wanted to send an SMS to the patient. We could do that too, right? It's using this exact same format. Just instead of picking a form, we would pick a smart flow, right? And then we can pick the template that we've developed here, okay? Our welcome template. Now, if you're going through and setting these up, you might want to create these templates on your own. So you can click this button and here's our welcome template, right? And it's set for going by SMS. And it just says, hello, patient first name, welcome to our clinic, right? And that's it. So for an SMS, all you have is the message that comes through on your phone. So we don't have to worry about all these other options here. You will notice one thing that this is kind of a substitution field, we call it, or a variable, right? So I can look through this list and anything I see here, I can insert as a placeholder so that when this message goes out, it's gonna say, right, hello, John. right? So we could just as easily add something to this workflow that says this SMS should be sent, right? And it should be sent on the current day. All right, so maybe we can go ahead and add this in as well. Okay. All right, so we've now gone through the process of thinking through what needs to happen and then actually building it.